I have lived long enough to know that there are no quick fixes, no true shortcuts, nor no unadulterated workarounds in life. You simply have to go through. I turned 50 this year and it was all good. I posted photos on my birthday proclaiming, this is 50. This is the middle of life. I'm loving the skin I'm in, the space I hold. I'm loving myself, grateful for life, and feeling good. I've come to a place in my life where I can accept the highs and the lows, reconciling that my decisions, actions, and experiences have made me who I am and got me exactly where I'm supposed to be. And then, boom. 6 months later, I'm in severe pain, questioning everything from my physical, mental, and spiritual health. My name is Jennifer Mitchell Early. I help individuals and teams achieve organizational and personal success by providing customized training, resources, tips, and tools to help you pursue purpose and accomplish your goals. If you're looking to grow and evolve personally and professionally, be sure to subscribe and don't forget to hit the notification bell so that you'll be notified every time I upload new content. I don't know what happened. It's like a switch flipped. I woke up one day and my body suddenly seemed to be in flux. I now needed to wear my glasses damn near all the time. In the grocery store to see the aisle signs clearly and read the ingredients on food packages. At night when driving, during the day when I walk my dog, and definitely while I work on any of my devices. I went from 20/20 vision to being nearsighted and needing bifocals. I am officially in the stage of life where I have readers stashed in every room of my house. Then my back started to hurt consistently. I have chronic back pain and have been in pain for the last 6 months. My back hurt so badly that I couldn't bend over, stand for long periods, sit for long periods, couldn't twist, couldn't roll over, couldn't sleep or do the basic day-to-day functions of my life. For example, getting out of the bed and walking down the hall to the restroom was challenging. Desperate for relief, I did red light therapy, went to the doctor, got x-rays, saw a specialist, and was prescribed various medications. During my doctor's visits, I was told that even though I was in severe pain, I would have to continue to move to get better. Rest would only make things worse. Did I say it hurt to move? Knowing that I couldn't wish the pain away, I began to execute a plan of action. So I do yoga to help stretch out and lengthen tight muscles. I do bar class to strengthen my muscles and my core. I continue to carefully lift heavy weights with modifications and walk the dog. That regimen, along with physical therapy, has helped me to be able to sleep through the night. And now I only have light or moderate pain. What I came to realize about pain, at least in my situation, is that it's easy to spiral. I was stressed, exhausted, in chronic pain and feeling helpless. In that state of mind, it's easy to get depressed and begin to question everything. However, what I ultimately understood was that I was going to have to push through because there was no quick fix on the horizon. I don't know what your pain is. Perhaps it's physical, like my injury, or maybe it's physiological or emotional due to trauma that you experienced at one point or another. Maybe it's spiritual or even financial. Whatever your pain, it's valid, it's real, and it's powerful. According to the Mayo Clinic Health System article, Pathways Through Persistent Pain, Tips for Managing Chronic Pain, 3 out of 10 people in the U.S. live with chronic, persistent pain. Chronic pain is physically and psychologically stressful, and its constant discomfort can lead to anger and frustration with yourself and your loved ones. Physical and emotional pain are both unpleasant experiences that can affect our well-being and quality of life. They share some common neural pathways and mechanisms in the brain, such as the anterior cingulate cortex, the insula, and the amygdala. These regions are involved in processing the intensity, location, and emotional aspects of pain. Physical and emotional pain can also trigger similar physiological responses such as increased heart rate, blood pressure, and cortisol levels. Furthermore, physical and emotional pain can influence each other, as chronic pain can lead to depression and anxiety, while emotional distress can exacerbate physical symptoms. Therefore, it's important to recognize and treat both types of pain with appropriate interventions, such as medication, therapy, exercise, and social support. There is no single cure for chronic pain. It takes a team approach and involves medical management, movement therapy, and learning specific coping strategies, such as managing your stress. Emotional and physical pain are closely related, and persistent pain can lead to increased levels of stress. Learning how to deal with your stress in healthy ways can position you to cope more effectively with your chronic pain. Eating well, getting plenty of sleep, and engaging in approved physical activity are all positive ways for you to handle your stress and pain. For example, practice breathing exercises. Inhale slowly through the nose. Allow your lungs and belly to expand. Then exhale slowly through your mouth and nose. Engage in mindfulness. Meditation does not have to be fancy or complicated. Allow yourself to focus on the present moment, letting go of any interpretation or judgment. To start, try paying attention to one sensory input at a time, such as hearing or vision. Work with a physical or occupational therapist on appropriate exercises to gradually retrain your body. This has been very helpful for me. Talk to yourself constructively. Positive thinking is a powerful tool. By focusing on the improvements you are making, i.e., the pain is less today than yesterday, or you feel better than you did a week ago, you can make a difference in your perceived comfort level. For example, instead of considering yourself powerless and thinking that you absolutely cannot deal with the pain, remind yourself that you are uncomfortable, but that you are working toward finding a healthy way to deal with it and living a productive and fulfilling life. Be sure to use moderation and pacing. Set realistic goals and start by doing 1/3 of what you think you can do. For more difficult tasks, try setting a timer to remind yourself to take a break. Become active and engaged. Distracting yourself from your pain by engaging in activities you enjoy will help you highlight the positive aspects of your life. Isolating yourself from others fosters a negative attitude and may increase your perception of your pain. Consider finding a hobby or a pastime that makes you feel good and helps you connect with family, friends, or other people via your local community groups or the internet. When you participate in meaningful activities, the body's natural feel-good chemicals called endorphins are activated. Set aside time each day for a simple activity that is calming or brings you joy. You can also incorporate a gentle stretching program, exercise and relaxation techniques into your routine, such as yoga or Tai Chi. Find support. Going through the daily struggle of your pain can be extremely trying, especially if you're doing it alone. Reach out to other people who are in your same position and who can share and understand your highs and lows. Search the internet or your local community for support groups or talk to close friends and family, which can reduce your burden by helping you understand that you're not alone. Practice good sleep habits. It's so important. Establish regular bed and wake times. Still working on this one. Use your bed for sleep and sex only. Do not spend your day there. Eliminate unhelpful substances. Smoking restricts blood flow, which prevents healing. Alcohol creates nerve damage over time. Consult a professional. If you continue to feel overwhelmed by chronic pain at a level that keeps you from performing your daily routine, you may want to talk with a mental health professional, such as a psychologist or therapist who can help you handle the physical and psychological repercussions of your condition. These are some general suggestions that may not apply to everyone. You should consult with your healthcare provider before trying any new treatment or technique. Remember that you're not alone and that there is hope for recovery. If you like the video, please hit the like button, subscribe if you haven't already, and share this video if you found it valuable. Thanks for watching, and I'll see you in my next video. And remember, keep moving.